Welcome to The Explainer. Today, we're jumping right into a super stressful, time-sensitive choice. What do you do when you lose your health insurance right before your baby is due? We're going to turn this complex problem into a clear, actionable guide.
So, let's just paint the picture. You're deep into your third trimester, everything's on track, and then boom, you lose your job-based health insurance. It is a tough spot, for sure. And you're suddenly staring down two really confusing options. Stick with your old plan through something called COBRA, or jump over to a new marketplace plan.
But don't worry, this explainer is designed to cut through all that noise. We're going to give you a super simple framework to make a clear, financially smart decision, like right now.
Okay, let's dive in. To make the right call here, you really only need to understand one single powerful concept that separates these two paths. This right here. This is the key. Think about all the money you've already spent on healthcare this year. All those copays, prescriptions, doctor's appointments. That progress, which some people call your accumulator, is literally the most valuable asset you have in making this decision.
Now check this out, because this frames the entire choice. With COBRA, you're basically just continuing your exact same plan, so you keep all that progress you've made. But with a new marketplace plan, whoosh, it's gone. That progress bar drains, and your spending for the year resets completely to zero.
And this is a brilliant way to picture the hidden cost of a new plan. I mean, even if the monthly premium looks a little cheaper, starting a whole new race means you could be on the hook for a brand new, full deductible, and out-of-pocket max right when your single biggest medical expense, the delivery, is about to hit.
So let's get to the core of this whole thing and see how this one idea builds into a simple calculation. We're going to turn this confusing, emotional decision into some simple math you can do in, under a minute. It all comes down to these 3 quick steps. Seriously, that's it. We're going to grab a few numbers from your current plan, plug them into a simple comparison, and then just double-check the really critical details like timing and doctors. Okay, so here's the formula. It looks simple, and it is. A is just the amount you still have left to pay to hit your out-of-pocket maximum for the year. C is your monthly COBRA premium. You just add them together. Then you compare that total to what a new marketplace plan would cost you for both its premiums and its own brand new out-of-pocket costs for the delivery. And hey, this isn't just theory. The source material highlights a real case where a family was already super close to their out-of-pocket max. By choosing COBRA for just 1 month to cover the birth, they saved hundreds of dollars. Why? Because nothing reset to zero. This table here really helps you see how the math plays out. If you're in that high-spend scenario where you've already paid a ton towards your max, you can see how COBRA becomes the much cheaper option. But if your spending is low, yeah, a subsidized marketplace plan could easily be the winner. Just find the column that looks most like you. Okay, so now you've got the math down. But let's talk about the calendar. Because with health insurance, you know this, timing and deadlines, they are everything. COBRA has this amazing feature. It's retroactive. It's like a time machine for your insurance. As this timeline shows, you get a 60-day window to decide if you want the coverage. And after you decide, you get another 45 days to make your first payment. And if you do both on time, your coverage snaps right back into place to the day you lost it, covering anything that happened in between, like, say, a delivery. Now, this is a huge difference. A marketplace plan cannot be backdated. It just can't. If you sign up today, your coverage will almost always start on the 1st of next month. It will not and cannot cover a delivery that already happened. So to avoid a 5-figure mistake, you've got to be aware of these traps. Those COBRA payment clocks are firm. Don't miss them. Remember, a new marketplace plan can't cover your past. And finally, once your baby arrives, a brand new 30-day clock starts ticking to get them on your plan. Okay, let's put a bow on this. COBRA is very often the clear winner if this sounds like you. You've already paid a lot toward your max, your due date is right around the corner, and you absolutely want zero drama with changing your doctors or hospital. On the flip side, a marketplace plan is probably your best bet if you haven't spent much on healthcare yet this year, which makes that reset to zero thing a lot less painful. It also wins if your COBRA premium is just crazy expensive, or if you qualify for big financial help through subsidies or something like pregnancy Medicaid. Okay, we've covered the why and the how. Let's finish up with a concrete action plan you can literally do in the next 15 minutes to get this whole thing solved. Here is your to-do list. Step 1, log into your old insurance portal and find those 2 key numbers, your out-of-pocket max and what you've spent so far this year.
2, find out your exact monthly COBRA cost. 3, run that simple A plus C calculation we talked about. And 4, this is a pro tip. Email your COBRA administrator today and ask for the newborn enrollment process in writing. Get ahead of it.
Look, we know this is a really stressful moment, but as the source material puts it, this is solvable. You now have the framework, you've got the action plan. A tiny bit of paperwork today can save you from a massive, massive bill tomorrow. You can do this, you've got this.